Now talking health, if the target of eliminating HIV/AIDS by year 2030 must be met, Nigeria must resist the temptation of being carried away by its recent progress against the epidemic, but stay the course by sustaining advocacy, promoting domestic resource mobilization, and taking a firm stand against stigmatization. First Lady Oluremi Tinubu said this in a keynote address at the 2025 World AIDS Day celebration organized by the National Agency for the Control of AIDS, NACA, at the banquet hall of the Presidential Villa. State House correspondent Adeniyi Taiwo reports.
In spite of its high burden of HIV/AIDS, Nigeria has acquitted itself well, scaling up prevention, treatment, and care of the epidemic, even in the face of dwindling donor funding, policy shifts, and uncertainties.
Under President Bola Ahmed Tinubu, Nigeria is on its way to eliminating HIV/AIDS as a public health threat.
Among many other gains, the 46% decline in new HIV infection recorded in the last decade was celebrated by stakeholders who gathered to mark this year's World AIDS Day under the banner of National Agency for the Control of AIDS, NACA.
I dare say,
for a woman who has been in the trenches, building coalition and mobilizing resources to fight new cases of HIV infection with the Free to Shine Triple Elimination campaign, Nigeria's First Lady Oluremi Tinubu is happy about the emerging figures, but wants more to be done.
We are moving steadily towards the global target of eliminating mother-to-child transmission of HIV, syphilis, and hepatitis by 2030 through efficient use of resources and integrated healthcare services for women and children. As global funding patterns shift, we must ensure sustainability to prevent disruption of critical services. The federal government, as you have heard, has proactively approved the disbursement of $200 million to support HIV, tuberculosis, and malaria program. As we move forward, I call on all Nigerians to support the renewed hope agenda of His Excellency President Bola Ahmed Tinubu, GCFR, in the commitment to achieving an HIV-free Nigeria by 2030. To our parents, guardians, and teachers, HIV/AIDS is no longer a disease of shame, but should be brought to the table for discussion. To our young people, I encourage you to take responsibility for your health, get tested, and know your status. To our communities, let us foster a culture of love, acceptance, and support for people living with HIV.
Her commitment to the campaign against HIV/AIDS was recognized with an award at the ceremony.